thanks to everyone who's joined today. Thanks to everyone for your hard work, everyone on the panel, and for speaking today. I just wanted to put the bill into a little bit of context, I guess. And I've been thinking about how news of the national insurance tax rise has been very difficult for many of us to hear and process, as it will significantly disadvantage working people across the country. The money is apparently going into the NHS to tackle waiting lists, but we know that that by no means results in the money actually being used to improve services or patient care within the NHS, and it will likely be squandered quite irresponsibly. Sajid Javid this morning spoke about this, and there was no strategy, no real targets, and given the lack of transparency we see respending, particularly within the NHS and around social infrastructure, it's unlikely we will know what happens with that money. I think it's also important to mention the fact that in April, peers in the House of Lords, for example, have had their attendance allowance increased above inflation. They've seen an above inflation rise to £323 a day, which happens to be pretty much exactly the same that is provided to people accessing universal credit per month. And we also hear that the 20% uplift is coming to an end next month, and that is expected to plunge thousands of people into poverty, which happens to be the biggest indicator for mental health. So I think the government's priorities, if not already clear over the past couple of years, have become all the more obvious. The government isn't interested in prioritising those struggling most in society. And I think that's maybe why they've also, sorry, I think that's also probably why we're seeing such lack of interest in prioritising the NHS, and why we've seen such a degradation from the government, in terms of funding, in terms of cuts, and it's now reached a point of real inadequacy. The NHS isn't doing great. We're hearing about an upcoming winter crisis, which is going to be worse than ever. We hear that every year, and it's true every year. It does get worse, and the truth is that the bed crisis, the maternity crisis, the winter crisis, the mental health crisis, the emergency service crisis, the wheelchair crisis, maternity, etc., these crises are all a result of austerity, of closures, of privatisation, and of real strategic dismantling of services. And I've seen this demise really of the NHS. As a clinician, I've worked for over 10 years in the NHS in mental health services. I've also had I've had the misfortune, I suppose, of really witnessing the demise on people's mental health and physical health, which go hand in hand, obviously. But also as a patient, I've also witnessed the glory of the NHS and the really hard work of many of its staff, but at the same time witnessed the way it's been failed by the government and how it's therefore failing its patients. And that's the main thing for many of us who work in the NHS. Patient care is so significantly compromised. It's really difficult working in the NHS when you've seen what it's capable of, what we are capable of providing, and we are no longer able to do that. I just want to share an experience of a friend of mine. I think really contextualizes the problems with privatisation. They've been experiencing really chronic pain. They're being sent to different hospitals because you're sent wherever that particular clinical specialty is catered for, and there are different treatments. You're going to different hospitals. They went for a procedure today or earlier this week, and because their notes were not properly communicated or handed over between services, they were sent home. They didn't have the procedure. And going from different hospitals, so far away from home, you're obviously not sent you're not sent to your local hospital because they can't provide that care anymore. You're going very far away from home, you're experiencing chronic pain, and then you're prepared for a procedure that's quite stressful, both physically, both mentally, requires preparation, requires you to get support for after the procedure, and you get sent home. You're not informed properly because the communication is not working, and that is a direct result of privatisation. The records were not up to date. The communication of services, it could have meant for a really critical failing. And this is due to different record management systems. Each trust is not just responsible, but they are forced to contract out their patient management systems. And that means that it's not unified, it's not joined up. which really would be the case if it was a nationalized health service. You know, they're like little separate businesses at the moment, and it's not cohesive and it doesn't work. I think the government has strategically destabilized the healthcare infrastructure. I mean, I didn't realize Chomsky had said this, and you know, he's a man after my own heart, so I'm not surprised. But they've destabilized it so it crumbles under pressure, is less effective at the best of times, and is incredibly weak and incapable when it really, really needs to be working very well because of a pandemic or, you know, health crisis. Um, and it can't provide good quality of care to patients. It's made more useless, and the prospect of privatisation becomes far more appealing, and that's how the public are won over. And it just reminds me of when I was leafleting for the election a couple of years ago, and the people that I came across who were going to be voting for the Conservative Party, the only real argument they had is that the NHS isn't working. You know, I looked at a few comments on this particular meeting as well, and it was a similar thing. You know, the NHS isn't working, but for some reason there's a failure to make the connection that these problems are due to privatisation. Therefore, more privatisation is not the answer. It's only going to make the situation worse. This health and social care bill, it's going to make it easier, as many have said before me, it's going to be easier for private companies to be awarded contracts with no competition, and also sit on these aforementioned ICS boards and decide how money is spent. Obviously a conflict of interest. It's obviously a recipe for disaster. If the focus is on profit, as it has been over these past 2 years or so, things are only going to get worse in the NHS. Commercialisation naturally downgrades quality of care, and this means that those worse off will suffer the most. You know, Sonia mentioned health inequalities. Of course, that means minority communities who happen to have already fared the worst will continue to suffer and struggle. It's wasteful, it's dangerous, and most importantly for me, I think at this moment, thinking as a mental health clinician, is that it will really result in a seriously compromised patient care due to plans to disband regulatory bodies overseeing the ethical and practical conduct of clinicians, as well as the ability and training. This will all compromise patient care. So it's really, really, really important that we talk about this bill, that we get people to support these campaigns, and to just find out more and really understand what's happening. And seriously, go on the Keep Our NHS Public website, share it on your Facebook. You know, please do get involved and help us stop this bill, because it is the public who are going to suffer the worst.